Hi, I'm Allie Easterly, a student physical therapist. So I understand that you have some interest in iontophoresis and what it can do for your lateral epicondylitis, and I know you've heard it could possibly help. So let's take a minute and talk about it. Why don't you start out by telling me what you know about your condition of lateral epicondylitis? Okay, so that is pretty accurate. It is from where your muscles attach at the elbow, but it's really caused by motion in the wrist and then the forearm, particularly bending back. In your case, it's really fitting that the common name for it is tennis elbow because you're a tennis player, and that is likely how it happened from a lot of your backhand and gripping the tennis racket during it. So why don't you tell me what you think that iontophoresis does? Okay, so that's also pretty close to what it does. It uses an electrical current in a pad that'll go on the area by the lateral epicondyle, and it'll administer medication right to that area that's the problem. So it uses it kind of like a magnet effect. So when you have magnets that have the same charge or the same polarity, so you bring them together and they push each other apart. So that's what iontophoresis does. It has an electrical current in it that has the same electrical current as the medication because everything has an electrical current. And so when we turn it on, the fact that it has the same means that the iontophoresis and the medication want to go away from each other. So the medication goes into your arm. Okay, so one of the big things that we know from research is that it does have some pretty good short-term effects. So we have a study that was done in 2012 that looked at the same medication that's an anti-inflammatory, so it helps with the fact that that tendon's been irritated, so it's likely swollen, inflamed inside. And it looked at the same medication being administered through iontophoresis and an injection, and found that if we use iontophoresis to do it, not only is there less trauma to the area, but you have a greater reduction in pain and a greater increase in the grip strength, so your ability to hold your tennis racket. And then there was a similar study done in 2019 that looked at iontophoresis and that same drug compared to a group that got iontophoresis with a placebo, so not a drug that was going to have any effect. And they had the same findings, decreased pain and increased grip strength. But both of those looked at it in a really short time period, so it was pretty closely after the drug had been given, they saw that effect, but they didn't necessarily see it months later. And when there was a review of all these studies done, or all the studies done up to that point in 2005, and they compared it, they looked at any study that compared it to different interventions, they found the same thing. So overall, what we know is that short term, we're going to see some benefits, which is good for you because I know you really want to get back to tennis. But because we don't know about those long-term effects, we need to combine it with other interventions such as strengthening, maybe stretching, to make sure that all those muscles are ready for that motion, repetitive motion, and we're not getting any overuse, and then your symptoms don't come back. So do you have any questions right now? What is your thought about what iontophoresis can do for you? Okay, well that all sounds really good and seems like you understand what we've talked about. Thank you.